And it says on there 180. I did that earlier this year, but actually it's 181 countries because Mozambique made it legally binding during the summer period. And it covers, next slide, a whole load of areas, from lobbying to demand reduction to the obligations around protecting people from passive smoking, packaging and labelling, awareness, advertising, smuggling, research, a whole array of obligations under the FCTC. But we're going to concentrate on that top one on the slide, which is lobbying and the call for a limitation in the interactions between lawmakers and the tobacco industry. Next slide. And then it's 2 clicks on the next slide. And what the general obligation is within the FCTC, it actually states in settings and implementing their public health policies with respect to tobacco control, parties shall act to protect these policies from the commercial and other vested interests of the tobacco industry in accordance with the national law. Next slide. But when we say tobacco industry, who are we talking about? This is not just Philip Morris or BAT. This is the tobacco industry, meaning tobacco manufacturers, but wholesalers, importers, and importers of tobacco products. And the reference also includes other entities that may quite obviously be working or less obviously working for on behalf of the interests of the tobacco industry. And I think for us at a local level, that's sometimes where it becomes more complicated, and I'll come back to that. Next slide. So, tobacco industry, who are we talking about? This is just some examples of tobacco industry allies that you may not directly think of as the tobacco industry. So the retailers, labour unions, recipients of research funding. So you may see research that looks legitimate, look underneath, and it may have had tobacco industry funding or sponsorship. You may see an organisation that appears to represent small shopkeepers, but look to the back of it, and it may be that they receive funding from the tobacco industry. So it's not always just those who are obviously connected. We have to be mindful that there are others that do not always outwardly show where their funding and allegiance is. Okay, next one. So, protecting local health policy at a local level. So you double click, box will come up. The Department of Health has for some time been encouraging local authorities to follow the government's lead in this area. So while the FCTC talks about it at country level, and it talks about government, it does mean not just national government, but local government. So the DH has asked local authorities to follow the government's lead in this area and take necessary action to protect their tobacco control strategies from the vested interests. While we recognise there may be some legitimate reasons, and we'll come back and talk about what they may be and how you deal with those, even there, then DH is encouraging transparency as they do. Next slide. We've also, as we all know, have got a new tobacco plan that was launched by our new Minister for Public Health, Steve Bryan, earlier this year. And when you read that document, under regulation enforcement, he has made it really clear by saying, finally, there is a fundamental and irreconcilable, I can't say that word, conflict between public health and the interests of the tobacco industry under Article 5.3 of the FCTC, and that we have obligations under that treaty within the UK, and that the government will continue to uphold its obligations, but he reminds local authorities they are also responsible for meeting the treaty obligations. Next slide. Now, what we do know is that many local authorities want to and do this. And I just checked with Vicky early this morning, and 113 local authorities across England have signed the Local Government Declaration on Tobacco Control. And within that, there is a commitment to protect their tobacco control work from the commercial and vested interests of the tobacco industry by not accepting any partnerships, payments, gifts, services, monetary or in-kind research funding from the tobacco industry to their officials or employees. And that's really good that lots of authorities have made that commitment, but do they know on a day-to-day basis that that is actually happening within their local authority? And hence the toolkit that we're going to talk about. And I'm not going to say too much about this because Debbie Smith from Kent is going to talk next. We'll talk more about it. Kent actually didn't want to sign that declaration until they had ensured that they were meeting that obligation. And that's how we came to look at the need for local authorities to have some tools that would help them undertake that piece of work and ensure that they were meeting their obligations, and where they were talking to the tobacco industry, it was necessary and there was transparency. So what's come from that work, and with other local authorities, and Catherine will talk, for instance, about the work they're doing up in the northeast, is a toolkit to support local authorities to do this. Next slide. Why would they want to do it? It's a question that we got asked, everyone know, in Kent. And I think for us, the key rationale for that, sorry, did I say move slide? Are we on why local governments need to review its policies, Vicky?
We are indeed, yeah.
Okay, good, sorry. Transparency and openness, I think, is hugely important, not just to our officers, but our elected members, and for residents to see that is the way that their local authority does business. To protect the council from criticism over unnecessary engagement with the tobacco industry, and to help them ensure that the engagement is appropriate when they do it, and they've got those rules of engagement to go to when there is any approach or they think they need to approach the tobacco industry. And to be able to feel assured that the tobacco industry's any attempts to influence those health policy are recognised and dealt with appropriately. And obviously, all local authorities will hopefully want to meet their obligations under the FCTC slide. So working with local authorities, particularly with Kent, we came up with a process document and set out a roadmap of actions to support local authorities to take the appropriate actions. And what I'm going to do is go through what is, just in a brief way, what is in that toolkit. Next slide. So that's making the case. So we have, well, I think one of the key things we got asked is, why we're busy, why do we need to spend time doing this? Why is it important? So there's a document in the toolkit which will take you through making the case, and it gives examples of what the tobacco industry has done and continues to do in attempting to stop the implementation of the FCTC, in trying to undermine efforts to implement effective measures, both at a national level and a local level. And I'm sure all of you can think of examples at both levels. Why do we treat them differently? One of the questions I've been asked a lot is, okay, we're doing this with the tobacco industry. Why are they different from the sugar industry? Why are they different from Coca-Cola? So that document takes you through why we treat the tobacco industry differently. And the fourth document has got the WHO Framework Convention on Tobacco Control to ensure that you've got all the details. Next slide. one of the most important things to do, and I'm going to be very careful not to spend too much time on this because Debbie is a template for mapping. So this is a template which will take you through what the recommendations and summary activities in 5.3 are, questions to consider, current status and evidence at a local level, and which departments are affected by that recommendation, and suggestions for improving compliance. And then there's just a nice simple PowerPoint which enables you to gather all that information together easily and feed it back to the key people in your local authority. Next slide. We then need to think how you're going to remedy any potential conflicts and gaps. So one of the documents is a template communications log, because there will be a need for communication, but records need to be kept that show that you decided what was appropriate, this was appropriate, and what was said, what was done, what were the outcomes of the actions, etc. So any queries, you've got that there. Document 8 is an employee code. All of these things, by the way, can be tweaked because every local authority treats things slightly differently, has slightly different systems. So this is meant to be the core document for you, but for you to be able to localise it. And document 5 actually takes you on from the findings from the audit and gives suggestions on potential ways to improve or maintain good compliance in specific areas. So that's in Appendix A of the template mapping report. Next slide. This is not something, and Debbie, I'm sure you'll go through this, this is not something that can be done just by the Tobacco Control Alliance or the key stakeholders who have particular interest in tobacco control in the local authority. Well, of course, they should be given the opportunity to comment and to be involved in improving any policies. And I am saying policies here. You know, quite often I will get a call and people will say, I need a policy that will meet the requirements of Article 5.3. I think our experience is that it most likely isn't a policy, but it's looking at the local authority policies and procedures and looking at where something may need to be amended or added to actually meet those obligations, rather than having something totally separate that runs at the side of it, everything else. But it's really important, and I don't think you can even start this process until you've got the buy-in at a senior corporate level for you actually to be able to take the audit ahead and make the changes. And obviously you need political leadership and ownership of the policy to make the changes and to ensure that all elected members understand it in relation to their own portfolios is key. Okay, and so with that in mind, next slide, document 9 is also a template council statement, because I think this is really important, particularly because if there's activity in this area, it may get picked up by the tobacco industry, questions may be asked, and there may be questions even in the press. And obviously, we've attached the Local Government Declaration on Tobacco Control, because at the end of undertaking this process, you should be really confident that you are actually being able to commit to what you signed up to on the declaration. And for those of you who, and I'm not going to talk about this particularly here, but for those of you who've got a trading standards role, document 11 obviously takes you to Trading Standards Institute's guidance on which is very clear on engaging with the tobacco industry. I'm done, just about on time. Any questions we'll deal with at the end. Back to you, Vicky.
Brilliant. Thanks, Hilary. That was a really excellent overview of the documents and of the principles. We're now going to hand over to Debbie Smith, who is Public Health Specialist and Lead on Tobacco at Kent County Council. And as Hilary mentioned, Kent was one of the areas that piloted some of these resources, and we're really pleased, given Kent's comprehensive tobacco control policies, that they were able to be involved in this work. So Debbie, I'm just transferring control of the screen over to you. Hopefully this will all work smoothly.
Hello, can you hear me?
We can, yeah. At the moment, it's showing your screen. It's showing some emails.
My email.
If you could put your slides up.
Oh, how do I do that? Sorry.
You just need to open the presentation on your computer.
Okay, all right.
Just on your screen.
Yeah. Okay. Give me 1 second. I just realised I need to do that, otherwise I'd have had that ready, but that shouldn't be a problem. It is. Just wanted to concur with almost everything, or practically everything, that Hilary said, which is good news. But I think that really my presentation will give an example of Hilary's points and illustrations, and how we dealt with that in Kent. So if I move on, can you see the presentation?
We can, okay. Yes. Thanks, Debbie.
Okay. So just to give you a bit of information about Kent, the complexities of Kent did really sort of make the whole process for the FCTC process quite difficult for us. The fact that we are a two-tier authority, we work very closely with 12 district councils, and we have 7 clinical commissioning groups. And of course, Kent was very interested in signing up to the Article 5.3 in principle, and we wanted to go ahead with that, but we're very aware that working across the district councils and across commissioning groups as well, we work with a wider range of stakeholders, such as police and fire services, and we wanted to be clear and sure that the policies that we had and adopted would also translate in our work with partnership work with other organisations. So the whole complexity, it was not really just about a unitary authority taking this on board and being able to include this in our policies. So the framework Convention on Tobacco Control was something that the Kent County Council wasn't really necessarily au fait with, and we had quite a lot of discussions with our cabinet members and our leader of the council to actually explain what we felt, how Kent interpreted Article 5.3. And in first discussions, there was certainly an overwhelming positive reaction to signing up to Article 5.3, but it was very unclear really what, for the cabinet members, exactly what they were signing up to, and they wanted to be very clear on that. So I'm trying to. So, oh, sorry. So we knew that we had to challenge ourselves rather than just sign up to the article and say, yes, we agree with it in principle. We needed to feel confident that we're actually doing that. And that goes back to one of Hilary's comments about protecting the council from criticism. What the council didn't want to do was sign up to something and then be accused of not being able to follow that through, or actually being conflicting in practice in what we do in the council. So we had to ask, what evidence did we have that we are protecting our tobacco control work from the undue influence of the tobacco industry? And we didn't have any evidence that we were aware of. I have to admit that the first response of Cabinet and Council and senior directors was that they would all say that they felt confident that they weren't under any influence from the tobacco control, but they didn't have any evidence to support that. And so that necessitated the need for a review, an audit into our working practice. So we were able to say that if we did do a review, then we would be able to feel confident that we were protecting our interests as we thought that we might be. We felt as though a reason for doing this would be to fulfill our FCTC responsibility as a local authority. And with the many discussions in Kent, we sort of had to conclude that the majority view was that it was not about saying, we don't like the tobacco industry, we don't want anything to do with them. That wasn't our position at all. It was about being clear and open about any contact that we had and making sure that any contact that we did have was very transparent. So we had to sort of question and identify the necessity of working with the tobacco industry if that's what we intended to do. So the engagement that Hilary spoke about, we have to make sure that it's appropriate, and that's really our starting point for the review that we had. We also had to identify why we would treat the tobacco industry differently, and there was a lot of discussion around the ethical working with tobacco industry, but also working with other environmental issues, for example, or slave trade issues. So it was a whole ethical source that we had to consider and understand our practice, but we considered that in the wider sense, but focused more closely on the tobacco industry for this piece of work. So it was agreed that we would have an audit of our current practice, and within that audit we had an initial phase of on-site interviews that were conducted with selected departments and key members and employees within the County Council. That included trading standards, which are located within the County Council here. And that was quite an interesting phase. The purpose of it was to understand what the key employees and individual members knew about the practices that we had and how they could be influenced by the tobacco industry. So that work was undertaken, and then we also mapped the activities that fall within the remit of Article 5.3, and I've got a slide that will show that as well. We had to review and analyse our policies, and some of these policies were identified within the interview phase of the audit, so they weren't necessarily apparent to start with. And this happened in January 2015, over a very short period of time, 2 weeks, which was quite difficult to get members and senior managers involved in such a short time. And it feels like a long time ago now, but probably under 2 years ago. So the people that we engaged in the audit were the HR department and their policies. We included media communications, campaigns and events, our procurement team and commissioning and contracting team across the whole County Council, cabinet members, our strategic policy unit across the County Council, public health colleagues and trading standards colleagues. And all of these representatives had in-depth interviews around their current practice and what they know about external agencies, how they may influence the work that we do. So the summary of findings from the interview process were fairly pleasing, although there were some challenges there. We were informed that it was clear that we were committed to progressing with the 5.3 work. There were no major obstacles identified at the time, and that no overt tobacco industry interference was found in our current activities. But there could be covert tobacco industry interference that has not yet been identified. And I think this was because the level of knowledge amongst the departments and the people that were interviewed was fairly limited in terms of how tobacco industry could sort of interfere with some of the work that we do, that could be involved in some of the sponsorships in terms of funding for things. And although we weren't particularly aware of them, we didn't have processes in place to make sure that they didn't happen. More findings, that the members and employees, as I said, didn't really have that adequate knowledge. Soon picked it up through the process, but we didn't have anything written down that would make it available to employees and members at the time. Trading standards did a lot of work with external bodies, and that they were also unaware of how potentially they could be working in the tobacco industry's interests, and that a major effort, it was recommended that a major effort be applied by the County Council to make sure that the work that we do has been considered, and that we feel very confident that there's no interference present. We decided to develop a single strategy on Article 5.3 to raise awareness and to make sure that our policies did contain that information and awareness so that we can feel confident on transparency. Again, to pick up on what Hilary said, we did provide the raising awareness sheet and information for our departments and members, but we didn't find it necessary to develop yet another strategy. What we did do was work with our existing strategies to ensure that there was inbuilt assurances that we could feel confident that there wasn't any covert or overt interference with the tobacco industry in the work that we do. So we did produce an awareness raising paper, and we identified some simple tools and systems that went in with the policies, and that was really the guidance and the reporting tool. So that was the template for identifying and reporting any work that was dealt with the tobacco industry. and also working closely with departments to revise and amend their existing policies and strategies, including trading standards. So that meant that we didn't actually have to produce another strategy in isolation. And this is a sort of a diagram of our process and the plans and policies that we looked at. So we had the audit, and we had an assessment of our current policies and practices, and we had the recommendations that we were given from the audit that we followed through. So we developed an implementation plan for Article 5.3, which, as you can see on the left-hand side, involved the briefing paper, one for staff, one for members. Both were fit for public reading, so that it was in a clear, understandable way that, that everybody could understand without any jargon. We work separately with trading standards because of their unique position and work that they do with external organisations, and their role on illicit tobacco as well. And we looked at all of the existing plans on the right-hand side within the organisation. We looked at the Kent Code, which is our code of conduct for employees, for our sponsorship policy and whistleblowers policy. There is the Declaration and Conflict of Interest process, our Bribery Act policy, questioning, procurement and campaigns work, and the policies that refer to those as well. So within all of those, and for members of staff, we developed a procedure to record any work that we do for transparency, and to provide advice to staff and teams, either in recording or in how they felt if they were going to proceed with some of the work, if they weren't too clear how to identify any interference with tobacco industry, and also to ensure that everything that we did was open and transparent, and that we felt comfortable that everything that we did do would be open to transparency and for public consumption as well. So that was our process, as I say, very much like the guidance that that Hilary has talked about in the production of the toolkit, but this is really just the Kent's experience of that.
That's brilliant. Thanks, Debbie. A really comprehensive overview of what you did there. So we're now going to hand over to Catherine Taylor, who is the Regional Regulation Manager at FRESH, which is the Tobacco Control Office in the North East. Catherine will be talking to us about the importance of Article 5.3 for trading standards and the interactions between trading standards and Article 5.3. So Catherine, hopefully we can hand over to you now.
Okay. So I've got my slides on my screen. Can you see those?
We can indeed, yes.
Great, okay. So thank you. They've been really, really interesting presentations. So thank you, Hilary and Debbie. So as Vicky said, I'm the regulation manager with FRESH. So we're the tobacco control programme based in the northeast of England. I want to talk to you about the implications of Article 5.3 for trading standards colleagues, because really they are a key part of the tobacco control workforce. And I'm really grateful to trading standards colleagues who I've spoken to in advance as I've put these slides together. So just some background to the organisation that I'm based in and the type of work that I get involved in. So FRESH, if you don't know, is commissioned by 11 local authorities in the North East, and we deliver evidence-based activity to reduce smoking rates. So we want to encourage smokers to quit, we want to prevent youth uptake, and we also want to protect people from the harms of tobacco smoke. So as you can see on this chart, we've got 8 key strands to our North East strategy, and 3 of these are really closely associated with trading standards. So if you look at, say, between about 6 o'clock and 9 o'clock on the chart there, we've got reducing demand and supply of tobacco, tobacco and nicotine regulation, and reducing tobacco promotion. So as part of the FRESH programme and sitting under our strand around reducing supply and demand, we have a specific focus on tackling illicit tobacco as part of our broader tobacco control activity. So this is the strategic framework that we're trying to implement here in the North East. It includes 8 objectives such as partnership working, intelligence and enforcement, and evidence-based marketing and communications. So this is very much public health and regulatory services working together. One of those 8 objectives, objective 7 there, is around protecting policies from the tobacco industry so that our work is always in line with FCTC. And as well as working in the North East, we also work nationally with ASH and with the UK Centre for Tobacco and Alcohol Studies, and this is through the Illicit Tobacco Partnership. So we have a website, illicit-tobacco.co.uk, and we work with national partners including HMRC, Department of Health, Public Health England, and a wide range of others to try and provide strategic advice and guidance to others on evidence-based activity to tackle illicit tobacco markets. So do have a look at our website if you get the chance. So as I mentioned earlier, trading standards really are key in tobacco control. Trading standards are there for the protection of consumers, and when you look at tobacco, you're dealing with a unique product. So cigarettes, for example, when used exactly as intended by the manufacturers, will unfortunately kill 1 in 2 long-term smokers, and there aren't any other products available on the general market which can make this worrying claim. And really, trading standards have been crucial in advocating for, maintaining compliance with key pieces of tobacco control legislation. So just going back 10 years, these include raising the age of sale of tobacco products, introduction of graphic health warnings, removal of vending machines, removal of point-of-sale displays from shops, and most recently, the introduction of regulations around the EU TPD, so tobacco and related products regulations, and regulations around standard packs, both of which came into full force in May of this year. So why are we having a focus on Article 5.3 for trading standards? So, well, if we remind ourselves that the article is all about protecting health policies from the vested interests of the tobacco industry, then we can really start to understand why. So the tobacco industry has a vested interest in many of the same issues faced by trading standards, but for very different reasons. And as Hilary said at the beginning, the objectives of public health and those working in the tobacco industry are diametrically opposed. So the most popular area that they want to get involved in is around illicit tobacco, and in the most part, they like to portray the reality as being much worse than it really is, particularly around the size of the market. So secondly, they really want to be seen as part of the solution to the issues faced by trading standards, either by offering to work in partnership or perhaps supporting schemes that might seem attractive to local authorities. But evidence actually shows that in many cases they've been a big part of the problem. Again, particularly in relation to illicit tobacco, they've had to sign agreements with the EU and with member states to really better control their own supply chain. And in at least one instance, they've been fined by HMRC for oversupplying markets in the knowledge that their products are likely to then be smuggled. So thirdly, they really need to lobby against the introduction of effective regulation. So for example, around standard packs, which obviously did so unsuccessfully in recent years, and also the introduction of tobacco licensing, which is one of our really key advocacy goals. So many of you will have heard about the scream test. So if the tobacco industry screams about a new proposal or a new piece of legislation, then there's a really good chance that that policy will be effective in bringing down smoking rates. So for example, the tax increases introduced yesterday, a very key, very current example following yesterday's budget. So fourthly, they really need to, the tobacco industry really need to improve their corporate image, given the decades of deception that we've seen. They're really trying to get a seat at the policy table to talk about regulation. It's a key part of them trying to improve their image. But many will ask, can a leopard really change its spots? And finally, their market in the UK is declining rapidly. So around 15% of adults now smoke, which is incredible progress compared to the 60s and 70s when most adults smoked. So as well as focusing on increasing their market share in developing countries and developing continents like Africa and Asia. They really need to recruit new customers here too. And the sad fact is that is to replace those who either quit or who die as a result of their addiction. So I want to show you some examples of the industry and how they portray themselves as part of the regulatory solution. The first example here is taken from the Tobacco Manufacturers Association briefing on illicit tobacco. So this was widely circulated, and I'm sure some of you will have seen this. So the TMA are made up of the four major tobacco companies, so British American Tobacco, Imperial, and also Japan Tobacco International. So here in this briefing, this is just a couple of extracts. They're outlining their role in intelligence sharing and supporting enforcement, and also around collaborative working with the key law enforcement agencies. So someone who was unaware of tobacco industry tactics, they would undoubtedly be very impressed by these types of publications. Some more examples, so recent headlines in the publication The Forecourt Trader. The headline here, the tobacco industry actually often speaks in support of retailers and their compliance with legislation, and we obviously know that the vast majority of retailers would never sell illicit tobacco, would never sell to children. But here they're saying that 1 in 8 retailers sell illegal tobacco. So what message are they trying to get across here? Are they trying to scaremonger? In the same report, they mentioned that illegal tobacco products contain asbestos, contain mold, dust, etc., and also lobby against standard packaging. So whatever message they're trying to get across here, this is standard PR activity for the industry in sensationalising the illicit tobacco market. Here also is a tweet from the Tobacco Manufacturers Association, again showing delegates at a recent parliamentary event to showcase the results of their latest research on illicit tobacco. So this really is clear evidence, and just one of many really, of them really trying to ensure that decision makers hear their messages loud and clear. And then slide 9 is actually really recent and really current to us, and we think it's actually the screen test here in action. Earlier this month, Fresh, as part of its launch of the Keep It Out campaign, called for the introduction of licensing across the whole supply chain. So the Tobacco Retailers Alliance, so that's the TRA, and they are funded by the same members as the TMA, along with pro-industry blogger Christopher Snowden, all claiming that all we want licensing for is to raise money for those in tobacco control and to raise money for ourselves. What we actually want it for is to support trading standards and tackling the illicit tobacco market. We know it would be a really effective measure. So we've got some pretty negative coverage in the retail press, and all of this is when they were lobbying really hard against duty increases for tobacco, which, as we know, is unsuccessful given the 2% and 3% above inflation tax rises, which were announced in yesterday's budget. So how might the tobacco industry try to exert influence over public health policy via trading standards? Well, as Hilary mentioned at the beginning, it's really worth bearing in mind that approaches won't always be made by the tobacco companies themselves. They might be made by PR organisations, spokespeople, training organisations, which, if you just look a little bit more behind the scenes, many of them will be bankrolled by the tobacco industry. So some of you, I'm sure, will have your own stories about these, but here are just some examples. So they might request a meeting with your local trading standards department. They might approach your local authority with offers of support to tackle illicit. They might offer intelligence on illicit tobacco. They might ask third parties to offer support around tackling underage sales, for example. They might ask for a quote to accompany an article that they're preparing to really try and promote their role in tobacco control. And they might also twist that then to report that it's been working in partnership with your local authority, which we know that many authorities have been caught out in the past. If any of these happen in your local authorities, we'd really urge you to be mindful of your obligations under 5.3. So some practical tips for being mindful around that can be found in the guidance, which I think Hilary might have referred to earlier. So this is guidance for trading standards. It was produced in collaboration with trading standards colleagues, endorsed by the CTSI, Public Health England, and regional trading standards organisations. And I'll give you the link to this shortly. But really, this guidance recommends the simplest and most effective way of protecting yourselves is really to decline offers of support from the industry. How you do this is entirely up to you, but this is always the safest option. And remember, trading standards colleagues are the experts in dealing with the legislation that you're tasked to deal with. When it comes to illicit tobacco, we need to remember that the tobacco industry's only role in tackling illicit tobacco is very limited and it's very clearly defined. So that is when seized illicit tobacco products are suspected to be counterfeit, and a Section 9 statement is required for prosecution purposes. And actually, this is really important because the majority of the illicit tobacco market is actually made up not of counterfeit, but of smuggled and of illicit white products. And as has been mentioned in Debbie's slide and in Hilary's slide, be transparent. If you do have contact with them, make records and make this publicly available so that really no one has anything to hide. Any contact that you do have with them should be as narrow as possible to achieve the goals that you need to achieve. For example, if intelligence is offered on illicit tobacco, then this can simply be submitted to your regional intelligence analyst as per any other intelligence submissions that you might receive. There's no need for meetings to take place with the industry to discuss that intelligence. Again, if contact is made, then make it clear that they can't use that contact then for promotional purposes, which is a real risk. And we've seen some examples of that just recently. We would, though, urge caution around entering into agreements like that, because whether all sides will stick to such an agreement is obviously an unknown. And then finally, so trading standards colleagues, let your public health colleagues know if there is contact made by the industry. This is really an issue where public health and trading standards can work together, talk to each other, because it's really helpful for both professions to be aware of the situations. So there are my slides. So I wanted to share with you some useful links and resources. So some of you may have come across the Tobacco Tactics website. This website is really interesting and really useful. It's kind of a Wikipedia site almost. It gives some really good background on facts around the tobacco industry, the illicit tobacco trade, and actually the team there are really keen to work with trading standards colleagues to give them the knowledge and support that they need to be aware of when the industry might, covertly make approaches to local authorities. Secondly, the illicit tobacco partnership site, which I mentioned earlier. So on there, there's some really useful downloadable resources. For example, a PR guide, which we would encourage local authorities to have a look at to really help you put out accurate messages when you are talking publicly about the illicit trade, but also the guidance for trading standards on engaging with the industry, which I've covered really only very briefly here. The full version can be downloaded from that site as well. So they are my slides, and they're my contact details if anyone did want to get in touch.
Thank you, Catherine. That was a really comprehensive overview for trading standards. We're now going to hand over to our last presenter, who is Ian Willmore, who is the Special Products Advisor here at ASH, and he is going to be talking to us about local authority pensions and potential divestment from tobacco stocks. So I'm now going to hand over to Ian.
Did you say Special Products Advisor? I could advise on products, but it's normally projects. Okay, so I'm going to talk about local authority pension investments. Can people see me? See my
we
slide?
can now, yeah.
Okay, great. So Article 5.3 does not apply directly to local authority pension funds, which are a rather weird entity, but they are legally speaking at arm's length from local authorities. So the mere fact that pension funds have investments in the tobacco industry is not itself a breach of Article 5.3. Without going into too much detail, there are, I think, 89 local authorities pension funds in England and Wales, including some odd ones like the Environment Agency, and they've got something around 210 billion worth of assets under management, which is roughly 10% of the UK's GDP, and there are around 5 million people whose pensions depend on on pension fund payouts. So they're very large. They're at arm's length from local authorities. They take a conservative, with small c, view about their policy as a general rule, because they obviously want to get the best return. One of the odd things about local government pension schemes is that, unlike other pension funds, they are governed by statute in relation to their benefits. So in other words, the local authority has to pay by law the benefits to which the beneficiaries are entitled, whether or not there's enough money in the fund at any particular moment. So you can understand why people who run local authority finance are pretty careful about what they do with their investment. Roughly speaking, there are two arguments that people are going to use if councillors who are responsible for pension funds ask about tobacco investment. One is that funds have some duty to maximise financial returns, and two is that banning tobacco investment would increase financial risk. The first one is true, but that does not mean that you can't make long-term decisions about the balance of your portfolio, or that you can't take some ethical, environmental, public health considerations into account, provided that you don't damage the financial returns of your investments. So it can be perfectly lawful and reasonable for a local authority pension fund to exclude tobacco from its portfolio, and in fact the largest of all pension funds in this group in the UK, which is Greater Manchester, have actually done that. The government is sorry, I'm not clicking through my slides, excuse me. The necessity would be for any pension fund considering doing this to follow a very careful process. The primary thing that they are going to be looking at will be financial factors. In other words, if we exclude tobacco from our portfolio, will this do significant financial harm to our fund? Tobacco stocks over the last 10 or 15 years have generally done better than the average for the FTSE index, but they only make up around 4% of the FTSE all-share index and about 1.5% of the all-world index, if I remember correctly. So they're a relatively small portion of the market. Also, you could argue that just because tobacco stocks have done well in the past doesn't necessarily mean that they will do well in the future. Their past performance over the last 15 years has probably been because of their expansion in intermediate and low-income countries, and it may be that that becomes more and more difficult, particularly because of the provisions of the Framework Convention on Tobacco Control. So past performance is no guide to future performance, as they usually say in the adverts. We would be, I think, strongly in favour of trying to persuade pension funds to look at divestment from tobacco. But if you're going to consider doing that, it's very important that you make the right arguments and recommend the right process. I would say that a process would be to ask your fund managers, who are the people that are contracted to manage the fund, what their view is about the long-term financial viability of tobacco, and you could quote declining markets in developed countries, regulatory and litigation risk. So, for example, the industry is being sued for essentially second-degree murder in the Netherlands at the moment, and there are a bunch of other legal actions going on around the world. It could also include the likelihood that the Framework Convention will lead to more and more regulation in countries that are currently behind the level of regulation there is in the UK. You could look at the EU Tobacco Products Directive. You could also look at likely developments as a result of things like the UN Sustainable Development Goals, where a number of them are relevant to tobacco, but particularly the third of the goals. So you would need to commission some intelligent analysis to make the case that it's financially a secure decision to divest from tobacco. You would need good legal advice, and legal advice is not always helpful on this point. Some authorities have been advised that it would not be lawful to divest from tobacco, and that may have been because that's essentially what the politicians in charge of the authority wanted to hear, so they structured their brief in a way that got the answer they wanted. Clearly Greater Manchester got legal advice that they could do it, and they're a well-run and very, very large fund, so it would appear to be possible. ASH and Share Action, which is an NGO that lobbies through institutional investors, are publishing a revised guide to local authority pension funds and investments in the tobacco industry, which we've just about signed off on. So I would expect that to be on the ASH website and distributed by Share Action really in the next week or so. That goes into considerable detail about the legal framework relating to pension funds, but I'm not going to waste your time with that. I would say that Article 5.3 is indirectly relevant in that you can say the behaviour of the tobacco industry is so awful that it's the only industry in the world which is specifically precluded from lobbying on public health matters by an international treaty. So, there is just a basic contradiction between any area of the local authority investing in the industry and its public health responsibilities. That does not give you legal cover to divest unless you go through something like the process that we've recommended in our brief. My advice would be, if you want to pursue your local authority, one, I would get on with it because there is great pressure from government to consolidate funds. So Greater Manchester would be an example of that. And the more that happens, the harder it will be to affect the investment decisions, because the larger and more remote the funds will get. So now would be a good time to do it. I would also advise finding political allies who are trustees of local authority pension funds, or who act as trustees, and adopt a very careful approach before you go in there. Otherwise people will just say no, and that will be the end of that. So I do think this is a powerful weapon. Local authority pension funds are very large investors. It is possible to divest from tobacco, but it's complicated and you need to be very careful. That would be my bottom line. Okay.
Great. Thanks, Ian. That was a really good overview. We've now got a short Q&A. So we've had a couple of questions already, and I will start with one of these, which is quite a detailed question around involvement and approaches from tobacco manufacturers. So we've been given an example, which is tobacco manufacturers trying to help in relation to age verification policies and a scheme which is issuing age identification cards. Tobacco manufacturers are referring to this as part of their social responsibility approach, and the scheme has received backing from MPs. Specifically in relation to the card issuing, a serving member of the House of Lords chairs the managing board of which the Tobacco Manufacturers Association is a member, and they're offering free resources to local authorities to disseminate and discount age ID cards. So presumably our questioner has asked, MPs should not be backing this scheme, and should local authorities be accepting these resources? Perhaps that's something we could hand over to Catherine to first, and then if anyone else wants to jump in.
So I guess that is, a very common situation. Many trading standards will come across that situation, and I know we certainly have here in the North East as well. I think I'd probably for the questionnaire to get the guidance on trading standards. So there's specific scenarios in there around local authorities being approached with offers of support to tackle underage sales. So trading standards really do take the lead in enforcing, obviously, around age of sale legislation. When it comes to schemes that are supported by the tobacco industry, I think really the general answer would be, I think we need to remember the bigger picture here, that the tobacco industry really aren't our friend in terms of enforcing legislation. They're part of an industry which unfortunately does kill people. And I would say that as best and as far as you possibly can, remove yourselves from association with those schemes. I'm sure trading standards colleagues may have different opinions on that, but as we've said, the safest thing to do is really to decline offers of support, not engage in schemes that are supported by the tobacco industry or funded by the industry, and that would really kind of be the best way of protecting yourselves and staying in line with 5.3.
Great, thanks, Catherine. Do any of our other presenters have anything to add on this? Hilary or Debbie or Ian,
I think from a sort of a Kent perspective, I would agree. We would certainly have a dialogue in the, for example, with the Trading Standards Department, and to look to see if there are any other ways in which we would be able to adopt programs and initiatives that wouldn't be that wouldn't be involving the tobacco industry sort of in that way. So you sort of like mentioned discount ID cards. Well, then we would probably look at other ways of obtaining ID cards and other ways that we can work, perhaps more resourcefully.
Great, thanks, Debbie. So just, I guess, in some ways a follow-up to that question. We've got another example here, which is the tobacco industry using the idea of littering and tidying up the streets with offers of grants to support street cleaning. It's hard to get across to councillors how they should respond to these approaches, as they often see it as a business offering money to help with a problem. Do any of our panellists have any comments on that, on how they have been able to deal with littering or more generally this issue of approaches from the industry? Catherine, are you any thoughts on that one?
Yeah, so I mean, very similar principles will apply, and I think it's totally understandable that councillors will want to make sure that their local authority streets are clean and presentable. It's a key way that the tobacco industry can improve their corporate social responsibility by being part of Keep Britain Tidy and other similar schemes. I think what might be handy and helpful would be just to have a chat with any councillors who are keen to go down that route, just to let them know about industry tactics, just to provide a bit of a briefing on the subject. I know certainly a few years ago in our area there were examples of local authorities getting involved in schemes like this, and once kind of a light was shone on the maybe some of the most spurious reasons behind such joint schemes, I think councillors were less keen on becoming associated with tobacco industry backed funds. So sometimes it's just helpful to have just a brief conversation, and then ultimately it's the councillor to decide. But I think it's our job in public health and in regulatory services just to kind of expose some of the background to things like this. And I know it's really difficult because local authorities are strapped for cash and need as much support as they can get. But I think just sometimes having those discussions can really help in helping people to reach a decision.
Yeah, I think you're right, Catherine, and also you have to look at the exchange as well. So the you'd need to be assured that the exchange of receiving money wouldn't be perceived as the tobacco industry sponsoring the work of the council as well in any way, and record or advertise themselves in that way. So there have been, I mean, none that I'm aware of in Kent, but there have been litter bins that have said that who has sponsored and supported those bins and those programs. So it could be seen as another way of the tobacco industry aligning itself with the work of local authorities.
I would add that getting involved with the tobacco industry is a toxic act for politicians, whether they're local or national. And if I were talking to a local authority about a proposal to do something like this, one of the other points I would make is that this is a tactic the industry uses all over the world. So, for example, it's common in intermediate and low-income countries for them to offer training, vehicles, equipment, etc. to customs officers, on which my comment would be, what could possibly go wrong with that? I think once a politician is aware of the behaviour of the industry in this sort of area, then people would become very cautious about proceeding with proposals of that kind.
Yeah. Hi, can you hear me now? I lost everybody for a bit.
I can.
We can, Hilary.
Ah, right, okay. Sorry, I missed a bit, so I might be repeating. But I would also just take you back to the toolkit, because there are documents in there which will help you make that case to elected members of why we are rightly suspicious when offers come from the tobacco industry, and why we should maybe treat offers from them somewhat differently than we might view an offer from other industries.
Great, thanks everyone. That was a really comprehensive set of answers there. We've got another interesting question here, which is how public health teams and stop smoking services are able to manage contact from the tobacco industry when they have e-cigarette products, and when they are approaching you with the e-cigarette product at the fore, how we should manage that context. So, Hilary, perhaps this is one you could kick us off on.
I think it is. Thank you for that, by the way, Vicky. I think it is a more difficult issue, and I think it's one that a lot of areas are at the early stages of grappling with. And I also think that the tobacco industry is seeing this as potentially an opportunity to have an impact on our public health policy. I would go back to the rules of engagement. It may be that there's a perfectly acceptable a product that you want to use, but my view would be go back to the instructions within Article 5.3 and ensure that engagement is necessary, and that there is transparency, and that it is appropriately recorded.
Great, thanks Hilary. I don't know if anyone else wants to add anything there. Right, okay, we will move on to our next question, which is probably possibly one for Ian here, which is around countering adverse publicity in relation to pensions investments. So we've got an example where there's been negative local reporting of the council holding their pensions or some of their pension fund in tobacco stocks, and how they might approach dealing with that publicity.
Yes. Is that question being asked by somebody who works in the local authority or somebody from outside?
It is a local authority.
Yeah. Really, I think the only defence to that point is to embark on something like the process that I've suggested, which is asking the fund managers to look at the financial implications of divestment from tobacco, you need to ask them the right questions or you won't get the answer you want. Of course, if you're replying to an immediate piece of media coverage, you can make the point that it's extremely important that these funds are properly managed, that there are millions of people whose pensions depend on funds being properly managed, that the local authority has to pay the pensions whether the fund is adequately resourced or not, so it has potentially disastrous consequences for an authority if it has a serious problem with its pension fund. You can make all of those points, but I really think the defence is to say, yes, this is an issue which we need to look at, and we're going to embark on a process of getting advice on it and seeing whether we can do it without harming the financial performance of the fund. That's the bottom line, I think.
Great, thanks, Ian. Debbie, I think this is something that's come up in relation to your role in Kent. I just wondered if you had anything you wanted to add to that.
Well, not necessarily to add. I mean, we've had similar conversations in Kent. In Kent, we haven't withdrawn investment from pension funds from tobacco industry. But it's something that comes up all the time. It's an issue that is often raised, but we do stick with the point, certainly for the time being, that the local authority needs to get the best deal for the pension fund. We've taken the issue to, I believe, the LGA, but it has been raised higher to look into withdrawing from pension tobacco industry funding from the pension funds, but we haven't been given a positive response on that, or a response that we feel that we could work with. So it is a difficult one. It certainly comes up every time, and it seems to come up. It seems to be something that journalists like to raise as well.
So one point I should have made when I was doing the introduction is that divestment from tobacco is something of a trend among large investors who are not part of local authority pension funds. So AXA, for example, which I think is the largest insurance company in the world, or at least one of them, they've done that. AP4, which is a major Scandinavian insurer, Medibank in Australia, the largest pension fund in the UK, the largest public pension fund in the US, and a bunch of others. There's a long list in the document we're putting together. So it's not a weird and way out there suggestion that local authorities should be looking at this trend and making at least a process to discuss whether it's appropriate.
Yeah.
Great, thank you both. There's a question here for Debbie, I think, which was around your example and how you got buy-in to the audit process and how intensive that audit process was. So if you could give any details there around how you conducted that and whether it was a commissioned piece of work.
Okay. Yes, it was the work. I'm trying to recall the name, and Hilary might be able to sort of help prompt me, but we had a representative from who worked with World Health Organization who came in and conducted the audit. So we were certainly able to benefit from her knowledge and background on the issue and the topic, and know which questions were the right questions to ask. The audit was conducted in sort of 20-minute interviews with a long list of senior members, and was very intensive. We didn't really have any issues with colleagues wanting to take part, because I'd sent out, the process that I'd undertaken was to send out information, very, very brief information on Article 5.3, what we were intending to do, and asking them whether they would take part in an interview to talk about their role and fulfilment of this particular topic. And I think because it was something that some people may sort of known about and others knew nothing about, but as responsible for their policies and procedures, couldn't identify whether or not they were compliant or not, felt that they were really intrigued and that they wanted at least to have the audit so that they could feel that they were able to comply in the way that they that they should, and it was also a good opportunity for them getting more information about that as well. And I think the awareness raising paper, which did highlight some of the tactics involved from tobacco industries, that the representatives and colleagues felt that that could have been me that's been involved in something like that, but I wasn't aware of it at the time. Yeah. So I think the topic itself was extremely an interesting one that certainly raised their attention, but purely by asking whether these managers felt that they were compliant or not was enough to open the door to them finding out more and wanting to feel that they were compliant with these issues. So the audit was very short, over the 2 weeks, and quite painless really, but actually provided more awareness in doing this process than anything else would have done, really. I think it's very simple.
Yeah. Debbie, it was Sylviane Rath.
Sylviane, thank you. Yeah, I'm writing that down.
Yeah, Sylviane worked with us because she had that international understanding of Article 5.3, and I think everybody was interested because in most countries, I think in just about all the countries, they have not looked at how to support their local government to implement 5.3, and Debbie most likely understates what they did, because actually Kent worked with us to actually build that audit tool. So while they were learning, we were all learning from them at the same time in actually ensuring that we had a comprehensive audit tool that worked at a local level, and that input from Debbie and her elected member and other officers was really important in ensuring that we were putting something together that actually what is a very complex local government situation in Kent, that this could be used in that situation.
Okay, thank you.
Great. Thank you for that, Debbie and Hilary. It's really good to know more about how Kent was involved with this. I think this is going to be our final question. So I'm just going to ask each of you for your top piece of advice for taking this agenda forward and engaging councillors or other officers with this work. So who wants to kick us off with that? And say silence. We'll give you 30 seconds to think about it.
Well, I'll start if you like. That's helpful.
Great, thanks, Ian.
So I would look. So I would encourage everybody who has an into their local authority to try to get them to look at divestment. I would approach that probably through talking to politicians who are responsible for or interested in public health. I would discuss with them how you might raise this issue with members in relation to pension fund responsibilities, and then I would get external advice from Share Action or from the other NGO that I've now forgotten the name of. Sorry, it'll come back to me in a minute. As to exactly how to proceed. Tobacco-free portfolios is the one I'm thinking of, which has been advising large companies and large funds all over the world in how to divest, so have great expertise in this area. Okay.
Thanks, Ian.
Shall I go next?
Go for it.
Catherine. Yeah. So I think my top piece of advice, so obviously other than looking at all the toolkits and resources that are available, is for trading standards and public health really to work together on this, because I think together those two professions combined can be a real force for good in protecting ourselves against the interests of the tobacco industry. I know that some in local authorities are really closely intertwined, some are less so, but I think really to work together on this is probably going to be the most effective approach.
For me, I think really the most important thing is for your organisation to prepare a factual briefing, and it doesn't need to be onerous, but a factual briefing along with the responsibilities of the organisation, because it was certainly for us. I mean, I think really with anything that we do, if we want to get an outcome, it's about winning hearts and minds. And sometimes members in particular can be very nervous about the sort of ramifications of what we're doing. So, but I think that if it always goes back to the facts, why we're doing it, and the responsibilities that we have as public health organisations, as local authorities, then I think that that's usually the ammunition that can sway hearts and minds.
I kind of reiterate what the others have said. I would say, obviously, please do consider using the toolkit to make going through this process hopefully more straightforward, less onerous, and particularly if you've signed the local government declaration or are thinking of signing it. I think it's very important to make sure that we have the local authority is not just making that statement, but ensuring they live by that as a local authority. And for me, listening to discussions with local authorities, I think that one of the key arguments, and Debbie may or may not back me up to this, is for the elected members is about transparency and openness with the local community that elected them.
Yeah, certainly for Kent, yeah.
That's brilliant. Thank you, everyone, for your time, and I think that just about finishes us off. So just to let attendees know that we will be circulating slides after the webinar, and that the resources Hilary and Debbie have been talking about are going to be available online as well. So they'll be there for others to use and to build on. So thank you very much for your time, and hopefully this has been of use to everyone.
Thanks for organising it, Vicky.
Yes, thank you.
Thank you.